Blockchain decentralization of science could be what finally cures cancer, adds years to our lives, and ends corrupt monopolies of big pharma. DeSci is making medical research open source instead of obscuring data behind patent laws and private megacorporations' doors. Welcome to the Blockchain Bunker. My name is Drew, here to bring you the truth. Flu season may be over, but the lasting impacts of big pharma on society have never been forgotten. Massive lobbying efforts by pharmaceutical companies have made lasting impacts on the way science is rigged to fit the prevailing narratives. And the narrative is always in favor of staggering profits for the patent-wielding giants. But the science behind these patents is often vague, incomplete, and sometimes non-existent.
These vaccines work well against this virus, including the Delta variant. We just need to get more and more people vaccinated.
New blockchain ecosystems are on the brink of transforming medical research, drug development, and healthcare innovations to bring the power back to scientists that make them in the first place and the people that need them the most. If this is the kind of news that grabs your attention, make sure to smash that like button to get this disruptive tech information out to the masses and subscribe to our channel. Gustav Nilsson is an esteemed medical and metadata researcher who is advocating for the modernization of science industry as a whole with this blockchain technology. Like most development, projects start with funding. The first problem arises in the source of funding being government entities, aka your tax dollars, and only studies that fit the prevailing narrative get funded. We are going to be looking at several different crypto DeSci ecosystems that are aiming to solve this fundamental dilemma. First on the list, Molecule is an emerging platform that connects researchers to private funding from DAOs with the speed and fair distribution that we're all looking for in today's current day and age. The essential value within Mol token is created with IP NFTs. Intellectual property, like research data, is tokenized without the need for patents or startups, which breaks down major barriers for smaller research firms that are looking to build upon it. These IP NFTs are available within the public marketplace where they can be assessed by other scientists, investors, and stakeholders. The beauty of this process is that once the IP is on chain, it's owned by the DAO. No amount of big pharma money can buy it and privatize it. For researchers, that is a massive sigh of relief, especially after we've seen the last 3 years and the likes of Robert Malone's information be blacklisted. Molecule has also created an incubator program called BioDAO, and this accelerates the decentralized biotech growth within these organizations. At every step, this platform is transparent, scalable, and includes the patients along the ride who can participate in the ecosystem. One of the DeSci DAOs that is funding these new R&D projects is VitaDAO, who specializes in longevity research. Vita is also formed around IP NFTs, an open source science aimed at enhancing early stage prevention of aging rather than the typical late stage therapies that benefit big pharma. Both Vita and Mol are based on the ethereum blockchain. The next crisis of the scientific research industry centers around publishing, and that is where SciNet plays into this strength. Nilsson made this visualization to show how many years go by before a study actually gets published in a peer-reviewed journal. First, the study must appeal to the publication bias, adhering to whatever the current narrative is that's being pushed by the masses or the powers that be. If it passes that test, then there's an issue with peer reviewing, which is often done without any clear identification of who reviewed the data or if that data was revised before its publication. And finally, after years have potentially gone by, the most fitting data can be published in a very advanced format of a PDF, oftentimes missing data points or other critical information. The denaturing of data that occurs in this process makes it nearly impossible to easily replicate studies, an essential part of validating and moving research forward. SciNet is taking advantage of this problem and published the data on a decentralized cloud where it can be rigorously and transparently peer-reviewed in real time. The SciNet ecosystem allows for labs and individuals to monetize their data and maintain credit for their discoveries on a fully decentralized marketplace. Hosted by ICP, of all projects, pretty cool to see. Although these projects are still in the development phase, it looks promising for modernizing the future of scientific publications on the global stage. The final crisis is affordability. The patent system allows for exorbitant price gouging to go unchecked, and unfortunately for the sick, the US is completely bought out by Big Pharma. The FDA has allowed Big Pharma companies to purchase influence over its drug approvals for the past 30 years with the 1992 Prescription Drug User Fee Act. Life-saving drugs are exclusively owned by behemoth corporations with the sole privilege of producing them, have been able to jack up the price as much as 5,000%. Distributing the scientific discoveries of new drugs among many scientists, researchers, patients, and investors allows for a DAO voting governance group to decide the price of the market. The future of decentralized science may be tokenized, allowing the exchange of cryptocurrencies to purchase drugs that were developed and critiqued on a global stage. Not only does this make for a truly democratic price process, but the quality of the drugs and the studies there within will be transparent to those who wish to participate and held to global standards. There are a ton of nuances of DeSci that still need to be addressed, like how DAOs will be treated as a legal entity, and ensuring that Big Pharma doesn't subvert these systems by complete buyouts of those DAOs. But the opportunity for crypto to transform the industry that has become calcified and corrupt is very tantalizing, and with enough support, we will wrestle the power back from these giant behemoths that have ruled it for so very long. There are many projects dedicated to DeSci, more than we could even possibly cover in just one video, but they are all on the cutting edge of transforming the way that we do medicine. But don't believe anything you hear, always do your own research. Stay in the know, and I'll see you on the other side of the future of science.